The month of May is Mental Health Awareness Month, and it's perhaps never been more important than now that we develop an awareness of issues surrounding mental health. After 2 years of the COVID-19 pandemic and the social consequences of the pandemic, there is data suggesting that mental suffering is reaching record high levels across the country and in our county. And add on top of that the political climate in which we're living, daily reminders of racism, homophobia, transphobia, and the increasing drumbeats of war. These are mentally challenging times for all of us indeed. Social, cultural, and historical factors that impact the mental health of communities that have traditionally been marginalized can lead to even deeper mental health burdens. There is data suggesting that the levels of mental health suffering, individuals who are reporting, that they're experiencing symptoms of depression, experiencing symptoms of anxiety, even individuals who are speaking about or experiencing suicidal thinking and active plans towards suicide are reaching record levels. There was a study coming from the Center for Disease Control early in the COVID-19 pandemic that was showing over 10%, that's more than 1 out of 10 adults in the United States reported that they were having serious contemplation, serious consideration of suicide at that time. You're not alone. You are amongst a community of people who are experiencing symptoms of mental distress, some of whom actually have mental health disorders. It's critically important that individuals address their mental health as a part of their overall wellness. Self care is so important. And I know that during challenging times when everyone is experiencing the stress of the moment, COVID-19, self care can feel like a luxury or an indulgence. And it is really not. It is essential, for an individual to help an individual to manage stress. And when I'm talking about self care, I'm talking about things like healthy eating, making sure that you're getting adequate sleep, that you're paying attention to your hygiene. Just because you might be working from home doesn't doesn't give you an excuse not to take a shower. Just in terms of feeling human, feeling well, getting regular exercise, making sure that you spend some time outdoors, even if that time outdoors has to be socially distanced. Um, get creative around celebrations. Don't let celebrations pass by without recognition. I think for many people, establishing a practice of mindfulness and finding one that works for you can be particularly helpful. When we think of mindfulness, I think many people think about meditation or yoga, but let me acknowledge that prayer is also a form of mindfulness that many people find helpful in terms of addressing mental well being. I usually recommend that people, if you have a primary healthcare provider, that is a good place to start in terms of a conversation about experiences that you may be having or asking for a screen as to whether or not you may be suffering from a mental illness. If you are at home and you're on a computer, Mental Health America has free, anonymous, and scientifically validated mental health screens that are available at mhascreening.org. And your screening result can start a conversation between you and your healthcare provider, or perhaps a trusted friend or a family member, and can really be a helpful place for you to start your journey toward mental wellness. Thank you for listening and be well.